Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Hi, good afternoon and welcome. I am Scott Branson, Director of Communications here at AARP Nevada. We're coming to you live today from our state office in Las Vegas as it continues to heat up. Make sure you stay hydrated, don't forget. But we're here today to talk about the Nevada State Legislature. Of course, in our state, every 2 years the legislature meets and decides on all sorts of things that impact the daily lives of not only all Nevadans, but of course, Nevadans 50 plus, and we're here today to talk about that. We want to tell you what happened, what we saw, what we were doing there to make sure Nevadans 50 plus were represented very well. And joining me today is AARP State Director Maria Dent. Maria, thanks for joining us, and congratulations are in order. You just recently got married.
Well, thank you for joining us today. I am so excited and thrilled that you are going to be hearing what we did at the state legislature. Of course, it's every 2 years, like Scott said, and it was a historical year. We had a majority female legislature, and that is something to applaud. But we did work on caregiving. Caregiving is a huge issue for us here in the state. We did work on retirement securities, and we did other consumer protection services. We had consumer protective services issues that we dealt with. In addition, later in the program, you'll be hearing about Stop the Greed. It's something that's happening nationwide, but a lot happening in our state. And Scott, I'd like you to talk a little bit about where we're going with this.
Yeah, absolutely. The one thing we wanted to do really today was to make sure that we kind of went over the issues that we saw in Carson City this year, and also make sure that you understand how that'll impact you, because at the end of the day, when the legislature meets every 2 years, they decide for us in our name, in essence, what new laws will take part or will take effect in our state. And so we want to make sure that you guys all understand that, and it's important to review that, because if you don't know kind of what's happened, and every year, July 1st, or after every session, July 1st, new laws come into play, and we see a lot of news media, they cover that, they cover it from a general perspective. What we want to do today is cover that, especially for the audience that we talk to, and that's for those of you 50 plus. And joining us today as well is our Government Relations Director, and that, of course, is Barry Gold. Barry, you have pretty much been, much to your wife's chagrin, I'm sure, been living in Carson City since the session began, and it ended in June, but thank you for being back with us today. You survived another session.
Well, absolutely. Carson City is a unique environment. There's a lot of people and a lot of competing issues, a lot of competing priorities people have to look at. What I will say before I say anything else is the voice of AARP Nevada, our members, and the 50 plus were heard in Carson City. AARP Nevada was thanked by a lot of legislators, agency staff, and a lot of the community partners that we worked with for making our members' voices heard in the legislative process. So it's always exciting, it's always great to be there, make a difference, make our voices heard, but as you said, it's always good to come back.
It is good to come back and come back home. And what we wanted to do first is start with you, Maria. So if we look at what was the goals when we looked at the session, because for those of you who aren't familiar with AARP and the work we do in advocacy, we do a lot. And going into each session and going into even at a national level for AARP nationally, we look at issues and then we decide a course of action. Maria, what were our goals heading into the 2019 legislative session?
Thank you, Scott. I also want to let the audience know that our session is only 120 days. So in 120 days, many laws have to be passed, and for us to really be focused is very important. And very important to our issues and to our members, especially is caregiving. Caregivers who are holding full-time jobs, part-time jobs in the workplace, also on a day-to-day basis deal with caregiving, be it for their parents, their children, their loved ones, their neighbors, sometimes their primary caregivers. That is an issue very important to us. And and the other issue is also financial security. We really find that it's critical for all of us to start saving at a younger age. We know that Social Security is there, but it's never going to be enough for us to retire. And so the thought that we should educate and talk about how do we work and save from the time we get into and earning our first paycheck and looking towards the future is important. So we worked on that issue. And finally, we work on consumer protection issues, and Barry can really go into the other details of that. But this has to do with working to protect our services around utilities, or payday loans, or guardianship, or home and community-based services. So there's a huge list of things we work on, but at the same time we're focused that it is for the good of the 50 plus and their families.
Okay, so yeah, I mean, just a jam-packed session, as you mentioned, Maria. Only 120 days to get through all of that. And Barry, I want to turn to you now and ask you, when we look at the priorities that Maria outlined that were important for AARP Nevada in 2009, important for all the folks out there, let's start first with caregiving and what we do. I mean, AARP has a long legacy of supporting caregivers, of looking out for caregiver rights, especially those family caregivers who have to do so much and sacrifice so much. Talk to us, Barry, about what were the key issues at the legislature this year around caregiving, and what did AARP do to help?
Well, family caregiving, unpaid caregivers, people who care for their friends, neighbors, and loved ones are very important. They are the main part of the healthcare system. They provide more care than anyone else. And for those who have heard me talk about it before, we have about 350,000 family caregivers in our state. Now here's the next part that's interesting. About 60% of them are still employed, full or part-time. So how do they balance those two things? How do they make sure they can still keep their jobs while providing care? There's been a lot of research done and said a lot of people have to quit their jobs or have to back off on their jobs, and that's just not fair because it costs them financially as well as the stress it puts on them. So one of the things AARP across the country and here in Nevada worked on is providing time off, paid time off for family caregivers from their job. The tagline that we use real frequently is, you shouldn't worry about losing your job because you have to take your mom to the doctor. Oh. So there was a bill that we helped testify on and support that got passed, and what that bill does is it gives paid time off to employees. It requires businesses for more than 50 employers, more than 50 employees. So large businesses with 50 or more employees have to provide 40 hours of paid time off to all of their employees. It's not seasonal or it's not part-time, so it's for most of their employees get 5 days, 40 hours a year of paid time off that they can use really for whatever. So it can be used for sick leave, or it can be used for what I'll call caregiving leave, to take care of their family members. So if they need to take their mom to the doctor, if she goes into the hospital, they can take that time off and not worry about losing their job. So that was a bill we were real pleased that got passed, and that's going to help a lot of family caregivers here in our state.
And I have to say that it's important that when we talk about caregivers, that we're talking about the daughter, the son, the unpaid caregiver, that person who goes to work at whatever shift, because we have 3 shifts here in Nevada or more, and then come home and have to take care of mom, or have to figure out how to get mom to the doctor. These are unpaid caregivers, not agency caregivers.
Yes, and these family caregivers do a variety of tasks. It's not just, sometimes it's getting the mail or helping prepare a meal, but these family caregivers, we've done a lot of research, AARP, and we found out that these unpaid family caregivers, the unsung heroes of our healthcare network, are doing medical tasks that once were only left to licensed, trained personnel, and now they're doing all those kinds of things, whether it's breathing treatments, whether it's complex medication administration, so lifting. There's a lot of things they're doing, and we need to find a way to help these family caregivers. You're right, Maria.
Yeah, and I know, Barry, during this legislative session, we had a big win when it came to sick days. Talk a little bit more about that, because I think for people, they look at it and say, well, you have a sick day, you have a vacation day. What's the difference? And what was the crux of the issue for caregivers in Nevada, and why was this important?
Well, the issue is there's a lot of businesses that don't give any paid time off to their employees for any reason. They just don't do it. And that simply isn't fair, because a lot of people need time off, whether it's for sick leave or paid time off or to do something, and it's work-life balance. So in other words, to get work-life balance, we really needed to find a way to help those employees that didn't have any paid time off. So this bill was worked on by the advocacy groups, it was worked by the providers and by the businesses and the chambers of commerce, and a lot of people got together and they said, hey, let's do something that's fair for everybody. So to provide 1 week, 5 days, 40 hours of paid time off, and it was important that they made it paid time off, not just sick leave. So it's paid time off. So it could be used for caregiving, because if it was just sick leave, if they just said sick leave, then you have the issue, well, maybe it's only sick leave just for you as the employee, and that simply isn't good enough. AARP was a very big, strong proponent that this paid time off had to be able to be used for family caregivers as well. So that was an important win that we got there in the legislature.
Certainly, and I mean, I know caregivers, all of them out there, because we encounter them so much here, both of you, as it relates to the stress, the involvement, the time, like you said, full-time job, both at work and at home, Maria, and this was really, I think, something that we've been focused on for a long time, and we've had big wins in the past at the state legislature, correct?
And actually, what I liked about it is that that message where you or Barry can come in to me and say, you know what, I have to take my wife to the doctor. All I need is 2-3 hours. Isn't it better to have that open conversation and say, you know what, I just need 2-3 hours off. I'm going to take my wife to the doctor. I'll be back later. I know that there's something critical, you wouldn't be asking for it, rather than calling me on the phone and say, I have a cold today, you know, and there goes a whole day of production.
Right.
Where I just think it leads for really honest dialogue and caring.
Yeah, no, there's no doubt about that. So a big win, and congratulations are in order, not only for Barry and Maria and the staff here at AARP, but all of you, because without you and your representatives
Correct.
supporting this and making your voices heard, this wouldn't happen, of course. Now, one of the other things that we talked about, and you touched upon, Maria, was around consumer protections, right? Not only is Nevada a state, I think, third in the country now, we just got some data in a few days ago around fraud, and of course at AARP Nevada and AARP overall, we have a great fraud watch alert program. But here there's a lot of consumer protections, whether it's payday loans, whether it's prescription drugs, which is healthcare related, but still there's consumer protections. What did we do in the legislature this year, and kind of what was our focus and our goal to make sure that people don't get ripped off?
A lot of it has to do with educating, in general, folks on how not to get ripped off. But in lieu of that, we do have to put safeguards in. If we don't put safeguards in, then people will be taken advantage of. We know that. Even the most savvy person can be called on the phone or can need a short-term payday loan and get scammed. You know, they're out there. They're always a step ahead of us. So I'd like to punt this to Barry, because he can give us really in a quick, you know, there's a lot of consumer protection issues that we worked on. And certainly we want to invite our audience to go to our website, because you'll get a lot more detail in this short time. I know we won't do it a lot of justice,
Sure.
But Barry, if you can talk a little bit about the consumer issues,
Sure.
that'd be great.
There's a number of areas that fall under what we call consumer protection. You mentioned payday loans. There's also things, you know, that are somewhat healthcare related, having to do with guardianships and powers of attorney. So let's talk about the payday lending and what happened this year. We had a very big win in payday lending, and AARP has been fighting against predatory payday lenders or short-term lending for a number of years. I will be the first to say that there are people that need to find sources to go and borrow $500 sometimes as a short term. There's people that you can't go to a bank, they don't know what to do, and that's what you want. And there's people whose credit may not be quite as good and it's more difficult for them. The problem is these places should not have predatory practices. They shouldn't be charging 400% interest. They shouldn't be giving loans to people that have absolutely no business getting them and no way to pay them back. So we had a very good piece of legislation that passed this year about payday lending, and what it did, it creates a database. It creates a database for payday loans to see who's taking them out and when they're taking them out. And the ultimate goal of this is so we can track how many payday loans people can take and when they're taking them out. And eventually, we're going to look at maybe passing some legislations that will prevent someone from taking a second payday loan to pay off the first one, because altogether that happens way too much. And a lot of times these payday loans, don't serve their purpose of giving people short-term relief, but they get them into a debt spiral that they can never get out of. So we created that database that's going to help. The other thing that it did is it put the federal military guidelines into our state statute. So for active military and for their dependents, which could include their elderly parents' dependents, it puts the military guideline regulations which caps interest at 36%, that is the most it can be, as well as some other protections. So in other words, we're kind of copying some of the federal guidelines because the military has had a huge issue on payday loans, and they've been able to get some things done federally. So we're able to match those here in our state because we have to protect people from getting into trouble without realizing that's what they're doing.
Well, Barry, and I think for some people it might be surprising to think of folks past their 50s, past 65 even, going to get a payday loan when a lot of them are retired or on fixed income. But that's why it's a bigger issue, isn't it? Because they're the least capable group of being able to really have the money to pay back, especially if they get into deeper and deeper trouble.
Absolutely. And the word payday loan may be a little misleading because they're also called title loans. People lose their cars. I mean, you watch TV and how many commercials do you see for whether it's title loans, payday loans, short-term loans? There's a number of these different names for them, but we're talking about short-term loans that are usually guaranteed by your next paycheck or not, or your title of your car, and people can lose their cars very quickly if they don't make those payments. And a lot of these loans, what happens is people aren't able to pay them off, so they flip them over and take another loan, and another loan, and another loan, and they end up, if they can ever pay them back, they end up paying $3,000, $4,000, $5,000 on what may start as a $500 loan. If I may talk about some of the other consumer protection things that we've done.
Absolutely.
We've done some things for insurance companies in the healthcare business. We're very big on insurance companies, protecting people from pre-existing conditions, from not being able to get insurance. We had a great piece of legislation that passed that prevented discriminating people with pre-existing conditions, something known as guaranteed issue. So insurance companies had to give you insurance regardless of your medical condition.
And Barry, if I might add, what's interesting about that bill is that this is something that we've worked on in the past, and if we're not vigilant, things sneak by, and pretty soon people are able to exclude somebody with pre-existing conditions. So it's a lesson for all of us as consumers to be vigilant and to understand that if we're not there speaking on behalf or representing yourself or going to testify or speaking out, that these laws sneak in, these little loopholes sneak in, and pretty soon in 2 months it becomes law, and we wonder, how did that happen?
Absolutely. And what we do, you know, our founder, Dr. Ethel Percy Andrus, said it very well. She said, what we do for all. So a lot of the things we work on isn't just for the 50 plus. It's for people of all ages. Another concern in the state of Nevada is guardianships and people who fall under a guardianship. Those are the most vulnerable people among us, and that's a big problem. And we passed some great legislation in the past couple of years for this, but we needed to do more. So another consumer protection bill was making it easier for someone to nominate a future guardian. So if you think maybe in the future I might not be able to make decisions and handle things for myself, and I want you to be my guardian because I understand what you want, but I don't want you to be my guardian because I disagree with you about just about anything. So you can kind of pick and nominate the person you'd like to be your guardian. We made it easier to do that. We also created what's called a power of attorney for people with dementia, which is a specialized condition with certain qualifying things about it that makes it easier for that. And it also gives some protection for people who do say, I want a power of attorney, and we don't have the time to go into the difference between a power of attorney and a guardianship, really that, but people who have powers of attorney who are able to make some decisions for people that restrict their ability to, let's say, place them in a residential facility against their will, unless the person expressly gives that ability to you. Say, yes, I would like you to be able to do that if the need arises. So we did a lot of things in consumer protection to help protect the most vulnerable among us.
The other thing about the guardianship, which many of us know by working within different agencies, is that in the state of Nevada, we attract a lot of folks coming in and have no extended family or a son or a daughter who might fit that role. And sometimes that role will fall to a neighbor or even a co-worker, somebody that they've known in their apartment complex for 30 years. we find more and more people are calling us. I just got a call yesterday from somebody who lost her spouse and now is at loss because her kids live in states far away.
Yep. And the last piece of legislation I'd like to mention that was really important is Nevada changed what was our Elder Protective Services program to a full Adult Protective Services program. Prior to this legislative session, our Protective Services program, which really does a lot of things watching out for the most vulnerable and going into facilities and in the community and making sure people aren't being abused, neglected, or exploited, could only deal with people 60 plus. So if you were 48 years old and you had a severe stroke, they couldn't help you. If you were 28 years old and suffered from serious mental illness and you were being abused in the community, they couldn't help you. If you were 58 years old and were suffering from early onset dementia, they couldn't help you. And that really isn't right, because our Aging and Disability Services Division, which is where that Adult Protective Services community lies, should be able to serve everyone. Now, there's a specialized one for children. Child Protective Services doesn't affect that, but now the most vulnerable who need help and need services to prevent them from being abused and exploited, they can now get that. So that was a big win, not just for AARP, but really for Nevada families.
Well, and Barry, before we move on and get back to you, Maria, utilities. We're in the heat of summer now, in both, of course, in the southern part of the state, but also in the northern part of the state. Real quickly, anything in utilities, because I know we do a lot of work there to make sure that folks on fixed incomes don't get their rates jacked up so high that they can't afford to even cool their home during the summer.
Well, there was an important piece of legislation that people might not understand helps residential ratepayers. AARP fights for residential ratepayers, so people only pay what's fair and reasonable and not a dime more. So people have heard a lot about the large casinos and the large businesses leaving NV Energy. And sometimes they decide not to, but when they leave NV Energy and they back out of NV Energy, that kind of leaves a hole in the infrastructure and some other things, and guess who ends up paying for that? You and me. So there was a change in the process, and I won't go into the process, but the idea for now, when anybody applies and wants to leave NV Energy, those huge corporations, not individuals like you and I, the process has changed, so now it will protect residential ratepayers in the future. So if a huge corporation or a huge casino industry leaves NV Energy, the residential ratepayers like you and I won't be forced to pay higher rates because of that. So that was real important, and that protects us in the future. And we were glad to support that bill, even though it has probably more to do with the big companies leaving, but the side effect of the new process helps us in return.
Yeah, and go ahead, Maria.
So what's exciting from my perspective and from our perspective is that I feel that when we work on issues at the state legislature, we're not only dealing with being selfish about our 50 plus, but as you can see, we're dealing with issues that affect everyone in our community. So I was really thrilled to see that we were able to affect changes that affect members of our community at large. So Scott, I know we're going to run out of time, so I want us to talk a little bit about where we're going from here. We're not going to let go things like retirement security. We're going to continue to fight on caregiving. We're going to continue to advocate on behalf of consumer issues. And then we are, of course, going into the election cycle. Who can ignore that? And here in the state level and across the nation, we are working on something, Stop the Greed. And this has to do with prescription drugs. So I want a little bit of time for us to talk a little bit about that.
Yeah, I mean, I think it's important too, because you will see as we head into, remember, Nevada is an early primary caucus state, right? We're going to vote for on the Democratic side and Republican side, but obviously Democratic side is more competitive with a sitting Republican president. We're going to be voting in January, so Nevada is going to be very high on the radar as it comes to this, and prescription drugs is, of course, a massive issue, Barry, for everyone. We dealt with a little bit in the state this year in the legislature as well. Tell us what we learned there, and then how that's going to inform us as we get full forward with Stop the Greed nationwide this fall.
Absolutely. AARP's nationwide program called Stop RX Greed is all about cutting prescription drug prices now. People shouldn't have to choose between buying food and medicine. So this can't be all done at the federal level. It has to be done at the state level and the federal level. And we all know sometimes more things get done much quicker at the state level. So we had some great wins here in our state and states all across the country. We had some great bills. We had a bill what's called prescription drug transparency, so that drugs that people take for asthma, if they increase over from year to year over a certain threshold, that the drug companies have to report to the state what's behind the price increase. Why are these drugs costing so much? And then the state can look at all those things and come up with how we can stop that. The governor had a great idea, and the bill was passed, creating the Patient Protection Commission. The Patient Protection Commission, he said, is to stop prescription drug gouging, the price gouging, and how to do that. There will be two consumer advocates on that Patient Protection Commission, and AARP and a lot of other patient advocates are really looking forward to participate in that. We had another bill that is going to create an interim study on the cost of prescription drugs and its impacts to the Nevada healthcare system. We have to start looking at this and studying it and making something happen. And then another bill that people don't know about sometimes is called the pharmacy gag rule. And there are some times in some places where pharmacists are not allowed to tell their consumers when they come in, oh, by the way, you can buy this drug cheaper if you don't use your insurance. Wow, who'd have thought of that?
So they're not allowed?
They're not allowed. That's why it's called a pharmacy gag rule. So we loosen that up a little bit, which allows pharmacists to give you more information on the cheapest way for you to buy your prescription drugs. So we did a lot of things about that and how we can make that better. And so we had some great wins here in the state, and we continue to work at the state level and at the national level to make things done.
Now, Maria, let's turn to you for as we start to wrap up here and we talk about Stop the Greed nationwide. This is an important campaign for AARP and its members, primarily because this really does impact so many people. And we encounter volunteers, we encounter folks out when we're doing our community service work that tell us, I have to decide between drugs and food this month because I can't afford both. Why this issue? Why now for AARP?
AARP has always addressed this issue in one way or the other. When we talk about Medicare or Social Security, there's never a moment when prescription drugs is not part of that conversation. We know that prescription drugs can be the highest bucket of money that goes out of a household. And when you're talking about someone on a fixed income, like you said, like Social Security, that's making very little or becomes widow or widower, and then suddenly half their income is gone, and if the male was the bigger earner, then the female is left with even less. You know, it is a huge issue. It affects health, it affects our community, it affects everything. It is so important that we have healthy communities, healthy people, and if we can at least have fairness in our prescription drugs and not that price gouging, I think it's only right that everyone can afford the basic, sometimes basic prescription. You know, it could be, you know, think about what we're taking, and we're not even at the age where we're taking even more prescriptions. It is critical to our health, and if people are not taking their prescriptions, they will end up in our emergency rooms. These are folks that then spiral into huge costs, and it's not fair to them, and it's not fair to our community. And how do we afford all this?
Yeah, and Maria, prescription drugs too. The thing that excites me about the issue, I should say, and where we can take it is that it truly is bipartisan. We're a nonpartisan organization here at AARP, but as far as people, whether they're on the left, on the right, in the middle,
doesn't matter.
It impacts everybody.
It impacts children.
Right.
It impacts and parents who have to decide, you know, I have a kid that's very, very sick, but I have another child that you know, maybe going out to play a little bit of t-ball. You know, I certainly don't have little toddlers in my home, but you know, getting out and getting some fresh air is just as important. But when you have to take all your resources and now you have to cut down on food, and you know, we want healthy families, and prescription drugs is at the crux of that. What is even more exciting is that nationwide AARP is behind this. And again, you're right, it's nonpartisan, it affects everyone. I don't care where you're from, what state you come, what rural town, what big city you come from. Prescription drugs is something that will affect us one way or the other.
And we're working hard with Congress right now, and they're hoping to have some prescription drug package bills coming out in late July or August. So everyone should contact your member of Congress and tell them we need to stop RX greed and to lower prescription drug prices. So there's a lot of bills they're working on, and we need to let them know we all support this.
And Scott, just really quickly, because I know we are going to run out of time, is that as these folks who are running for Congress or whatever they're running for, if we can elevate this in one huge voice, it's going to get heard, and they will have to do something, because that's what we're doing. We're building a big crescendo so that they can hear us. So if they're in Nevada, or if they're in Iowa, if they're in Florida, they're hearing that prescription drug affordability and stop RX greed is our message.
Right, and we have flashing on your screen right now a way to get involved, action.aarp.org. There you can sign up for emails where you'll not only get information what AARP is doing on a national level, but you'll also get specific to Nevada. So when things pop up in our state, we're going to have a lot of candidates running through our states. AARP will be there. We want you to come with us. We want volunteers to be out there. And Barry, if people want to get involved as we approach this election season, another presidential cycle, what should they do? How do they get in touch with us to do that?
Well, I think one of the ways you can do that is to reach out through the flashing on there and let us know and start to get information from us. And if you start to get those alerts, we'll be reaching out and we'll be looking for volunteers to help us either at our community events. We like to go around and we take our volunteers to the candidate events, and it's always good to hear directly from the candidates' mouth themselves what they're saying, and then they get to see us there, we get to ask them questions, we get to say, what are you going to do about prescription drug prices? What are you going to do about Social Security? How are you going to protect Medicare? So we really need to find a way to talk to these people and find these people who are running for office and tell them these are the issues that are important, not just to the 50 plus, but for all Nevadans and all Americans.
No, well said, and a great way to end it. Of course, we just last week participated in a roundtable on prescription drug prices with our Senator Cortez Masto. We were there with a bunch of other folks from the organization. So we're working on it. We need your help. Action.aarp.org. Maria, Barry, thanks for joining us.
Thank you. It was a pleasure. It was a pleasure to join you.
All right, and Barry throws on his stylish glasses. For all of us here at AARP Nevada, we want to thank you for joining us today. Of course, you can watch us. Please share this video with everyone who missed it live, because it'll be up here. It'll be archived. You can also find it on YouTube and Twitter if you missed it. But we appreciate you being here. We will keep you updated as we move ahead. Remember, stop RX greed, and thank you guys for all joining us. We'll talk to you soon. Bye-bye now.